about a year and a half ago, I implemented a pilot study or a pilot program at our institution where we were teaching end-of-life communication skills to our novice oncology nurses. And so I had a small group of nurses, 17, that we brought in for the first part was half didactic and then using case studies and some interactive learning modules on how to, number one, what are communication skills? What are some of them that they can utilize? Then we used case studies and allowed them to try out responses and how would they use, for instance, the ask, tell, ask. There's an acronym called NURSE of how you respond to a patient's emotions. So we walked them through those, and then 6 weeks later we came back and did a group discussion, a focus group. And really what I was hoping to get out of that pilot study was, did we increase their confidence levels? So it wasn't just did they get the knowledge on communication skills, but were they actually able to take that knowledge, implement it in their clinical practice, and then we brought them back and talked about that. And I used a 10-question survey, and in that survey, all of the responses went up in confidence levels from 0 to almost all 4 and 5s, which were very confident that they could at least implement them. So with that, what I was able to do is take it to the larger education group at our medical center. And we have since been able to implement the didactic portion. So they get an hour of didactic along with case examples that I teach at their 4-month of our nurse residency. So the program has gone from just our oncology nurses to all of our new graduates that after they've been at the hospital for 4 months, they come to their nurse residency class and I present to them both the skills as well as we talk about their personal experiences. So we do a lot of storytelling and case study examples of allowing them to use different strategies and techniques of how they talk with their patients in both end of life or even if it's just difficult. So it may not be an end of life discussion for a lot of our ICU nurses. It may be a transition of care or a new spinal cord injury. So dealing with goals of care, treatment plans, and things like that, and giving them some skills to at least start out the conversations.